Hey, this is Doc Yates. I'm a naturopathic doctor, registered acupuncturist, and a kinesiologist, owner of the Yates Naturopathic Clinic, and the founder of the interactive health website, Able Health. And this is the Simply Health Podcast, a show for females where I work to simplify and demystify the secrets of achieving optimal health naturally, based on my own experience in working with thousands of female patients over the past 15 years of my clinical practice. Welcome to Simply Health. Hey, this is Doc Yates, and today on the Simply Health Podcast, we are going to be discussing headaches with perimenopause, because typically the only treatments they give you is just Advil, Tylenol, painkillers, and that is, as you already know, and I already know, that is not going to be getting to the root cause in terms of why you're getting these headaches. And keep in mind, I'm not talking about someone who's had headaches their entire life and now they're still getting headaches during perimenopause. I'm talking about the types of headaches where you never used to be a headache person, you never used to get headaches before, and now, all of a sudden, you are getting these headaches with perimenopause, which means, what that means is like, in your 40s, early 50s, you don't necessarily, you still have a period, it may be changing, you still have a cycle, it may be changing, but it's still there. Perimenopause. So, that's the type of headaches I'm talking about. And I'm going to go through different types of how this works and what that means. So we're starting off with number one, is that all of a sudden with PMS, right before you get your period, you're getting headaches and you never used to get them like that before. So there's no other change except for the headache right before your period. And this is not just any headache, we're talking about a migraine. So migraine headaches before your period. In those situations, it means that your estrogen levels are dropping, and your estrogen levels are getting lower, and they're dropping even lower at that time before your period. In those situations, knowing that I don't prescribe estrogen to people when they still have a cycle, but it does mean that there are things that you could use, and that's where some herbal formulas for estrogen support come in, and that can help a lot with those types of migraines. So if you're getting migraines that happen just before your period, we're going to start with that. That's always, so those are herbs that you might have heard of. Let me think of some examples you might have heard of. Dong Quai would be one you've probably heard of. Lady's Mantle, Black Cohosh. Those herbs are very specific for that type of headache. Now, the next type of headache, it's not a migraine, but you're getting a lot of tension headaches and neck stiffness, sometimes even jaw stiffness, and it's the same time, though. It's right before your period. That tension is more so specifically related to progesterone dropping. So, and keep in mind, you can get a combination of these because estrogen and progesterone are both dropping before your period, and they're usually, your hormones are getting lower and lower, and they get to a point where they drop too much, and it leads to these symptoms. So, if you're just getting the tension headaches, which usually means tension headaches in the back of your neck or in your forehead, that is the sign of progesterone dropping. And typically with perimenopause and menopause, when I see those style of headache, the tension headaches that are coming on, that's with progesterone. Then I actually do use progesterone and prescribe progesterone for that. So it's a progesterone cream. You put it on before you go to bed. And you're not using it all the time. You're only taking it during the second half of your cycle. So let's say you had a 28-day cycle. So from the start of one period to the start of the next period is 28 days. Start of the first period is day 1. You would count 14 days. You would use progesterone from day 14 until you start your next period. And that would help prevent those tension headaches significantly. Point number three, it's a lot like point number 1, but there's a subtle difference. So it's still a migraine before your period. So it's still a migraine with PMS, and it's related with estrogen dipping down a lot at that time, but it's accompanied with a lot of water retention leading up to it. So there's a lot of water retention that you're getting with PMS. It's like your rings don't fit the same. You feel a lot more bloating in your lower abdomen, just kind of puffiness all over. And it's very common that you're even gaining weight during that time for anywhere from 3 to 7 days before you get your period. All this water retention. And then it's all dropping off and you're getting a migraine right before your period. This typically means that you have what's called estrogen dominance, so too much estrogen, and then it's dive bombing right before your period. So it's not that it's dive bombing really too low, it's just that you're starting so high that the drop seems like a lot to your body. And in those situations, we're going to do work to help your body detoxify any of the excess estrogen metabolites. And these are some simple herbal formulas. And if this is accompanied with low progesterone, then we correct that at the same time. So that's the third type. The fourth type of headache that you'll see with perimenopause, this is headaches that start showing up at ovulation. And just so you know, in terms of a timeline, as we discussed, the start of your period is day 1. Ovulation is typically happening around day 14, assuming you have around a 28-day cycle or so. So if you're getting headaches in the middle of your cycle, in perimenopause, and you never had this before, this is typically best treated with herbal formulas for hormone balance and, adding to that combination, herbal formulas for stress. Specifically, herbs that they use in Chinese medicine for what's called qi stagnation. When you're getting these headaches at ovulation, you got to work for hormone balance and qi stagnation. And there's a few herbs that have overlap for both. One of them being peony. I have found excellent results with that. Another one called bupleurum, and then you can combine that with things like Vitex, Dongquai for the general hormone balance. And a couple acupuncture treatments for qi stagnation, which you can see more details for that, for all of this at ablehealth.us. You can check that out and see how these different programs work. But for that type of headache, this is what you would want to do: herbal formulas, acupuncture, and that specific herbal formula. Number 5, other things that may have changed with your health that can lead to headaches in perimenopause, because there's other things that are changing. And if any of these other factors are problems for you, I would suggest by working with them to address them can help quite a bit. So one of those would be constipation. If you're struggling with constipation, and which means you're not having a regular daily bowel movement, and some people are not even close to that. Some people only go every 2 or 3 days. I think the record I've seen is someone who only went every 3 weeks. If you could imagine how discomforting that would be, like to only go to the bathroom every 3 weeks. That will lead to headaches. So getting daily bowel movements can help a lot in terms of headaches, because it helps with detoxification, it helps with detoxifying excess hormones. Another factor, especially for tension headaches, low magnesium. As I've said before, magnesium for all. Most people do better to take magnesium. So in taking it before bed, it makes your sleep more restful, it relaxes your muscles, and if you take enough, it can actually help with constipation. So it's like a 3-in-1. So take some magnesium before bed and see if that plays a role. The other factor that can play a big role with constipation is you'll see an increased sensitivity often to wine and coffee. This is really common that I see around menopause and perimenopause. Coffee, when they used to have no problems with it, all of a sudden their sleep is more sensitive to it. Or headaches are more sensitive to it. Or anxiety is more sensitive to it. And same thing with wine and sulfites. They never had an issue with it before, but now if they have wine, they don't sleep as well. They get more flushed in the face, sometimes more congested or sinus headaches. So really be aware of your coffee and wine consumption if you're struggling with any of these headaches. Work posture plays a big role, especially in tension headaches. And I've seen that a lot more since COVID, with people working at home and just not having a good work setup, maybe working from their couch or just from their kitchen counter. So be aware of your work posture. If there was any any changes in your medications. So if you're on any type of medications and there was a change in your dose or prescription leading up to the time when you're getting these headaches, you should probably ask your doctor about that. Say, can any of these symptoms or any of these changes cause headaches? Or just look it up, because headaches it's on the list of most side effects for most medications. So if that was something that happened right before you started getting these headaches, you need to ask your doctor about changing that back or adjusting your dose just to make sure. And then lastly, This one doesn't really play as much of a role, though it does play a big role in headaches that are not associated with perimenopause, and that's food sensitivities. So I know I said at the beginning of the podcast, I'm not really talking about people who've had headaches their entire life. It's more specific to headaches with perimenopause. But if you have dealt with headaches your entire life, you definitely want to consider looking into food sensitivities and getting those addressed. Personally, I prefer the elimination diet. For adults, for kids, I'll do food sensitivity testing, but I really like the elimination diet, which you also can access through Able Health. It automatically will build that for you. So I hope this was helpful to shed some light on perimenopause and the different types of headaches and treatments that can be associated with it. So this is Doc Yates signing off. Thanks for tuning in to Simply Health. If you want to learn more about health, check out Able Health. If you want to see some of the other projects that I've been working on in health, business, music, and life, please check out the links below.